Thank you. I'm audible and also PPT is clear. Okay. Thank you. So dear colleagues, a very good evening to all of you. First, let me thank IITDM for giving me this wonderful opportunity to meet all my colleagues. Some of them are my own students and many of you are from different parts of India. I belong to College of Engineering, Guindy, which was established in the year 1794, almost 230 years ago. And our first batch of telecommunication was graduated in the year 1948, almost 75 plus years ago. So I belong to such a legacy institution. And coming to the topic, all of you know that the current world population is estimated to be 8.16 billion, or in other words, it is 816 crore. And over half of the humanity now lives in urban areas, though not this may not be suitable to India. In India, almost 70% lives in rural areas, but across the world, the statistics says that 50% live in rural areas, that is 400 crores plus live in rural areas, 400 crores live in urban areas. And World Health Organization has a very important role to play in ensuring health as a fundamental right for all of us. Health for all is its slogan, is an objective, and all for health is our goal. Sustainable health, health equity globally is the way forward. If you look at the GDP of the world currently, it says around $111 trillion is the total GDP of the world. And USA, as all of us know, leads by almost 25%, 30% of the GDP is with the USA, $30 trillion. And we are at $4 trillion. You can see India is currently the fourth largest economy in the world with the $4.9 trillion. However, when you look at the per capita, we are almost very, very small. I mean, even 1/5 of Brazil, which is 10th position in the GDP ranking. However, we have a long way to go, and we will proceed. And India is positively growing forward. There are three industrial pillars of health: radiology, pharmaceutical, and digital health. These are the three important pillars which have a very serious impact on health. All of you would agree with me. And I have gone through the statistics. The healthcare industry, we have seen that the total GDP is $111 billion. And when it comes to healthcare industry, it's almost $21.2 trillion as of 2023. And in another maybe 2032, it will double, which is almost $44 trillion. In fact, 25% of the GDP, 20% of the GDP is very high. And in this statistics, United States leads the table with 3.78, almost $4 trillion, which is almost equal to our GDP. So our GDP is equal to the healthcare system of the USA, and our share is just 1%, which is 0.2 trillion. So this is the current position of India with respect to the countries of the world. Again, a glance of top trends, niche and cutting-edge technologies in the biomedical field. I feel these are the most important cutting-edge technologies of today: AI in healthcare, digital health informatics, wearable devices and transdermal patches, regenerative medicine and tissue engineering, robotics, prosthetics, personalized medicine, virtual reality, organ on chips, biomaterials, gene editing and therapy, rehabilitation, telemedicine, wearable and point-of-care devices, nanotechnology and biosensors, bioprinting, biomedical signal processing and imaging informatics, MEMS, NEMS, then the brain-computer interface, wireless body network, and many, many more. And these are the most focused areas as of today. The top trends, which rightly was given in the IITDM, their brochure I have seen, they have listed almost all the niche areas. Currently, for your kind information, the world is witnessing a big change, a shift, a radical shift. Earlier, we were only looking for preventive care, preventive breakdown, or it's a breakdown maintenance. As We become unwell, immediately we approach the doctor, diagnosis happens, and some therapy is given. This is how we have been, but that is not the right way of life. Right way is life is well-being. So WHO wants this to happen, which means there is a paradigm shift. Currently, the world is witnessing a shift from curative care to preventive care, from illness to wellness, from cure to well-being. This is what I have shown here as a small picture, cure to well-being. In this, preventive health plays a very vital role. Preventive health is the heart and soul of well-being. Why I'm putting this slide is, this is possible only with the technology. With the technology only, almost 8.16 billion, I have given you the statistics of the population, 816 crore people has to be watched. So I'm not taking a single country. Our country has around 1.4 billion, 140 crore people. China has almost equal to us. China and India itself has almost 300 crores. But if you take the world population, if you consider we as a citizen of the world, I'm worried about all the 8.16 billion. So the well-being of this 8.16 billion is not an easy job. Only technology can help us. So that's where the today's topic really is relevant. Preventive health is the, as I told you, the heart and soul of health, digital health. The key technologies of preventive health are wearable devices, which are helpful in measuring heart rate, sleep cycles, blood oxygen, artificial intelligence, which is capable of analyzing vast amounts of data, telemedicine for enabling remote consultations, mobile health apps for managing personal health, data analytics. And the benefits include early detection, identifies potential health issues before symptoms become severe. This is what is more important. Early detection is a very important step in realizing the preventive health. That's why the early detection is possible only with the technology. And personalized health creates tailored health plans and allows remote consultations, health monitoring from anywhere, proactive management, which empowers individuals to take an active role in managing their health, reduced cost. Naturally, when you have early detection, less is the suffering, less is the cost, more are the benefits. So you can see that the preventive health is fundamentally the very important to focus of today's current world health concepts. And the preventive health has its own objectives, key technologies, benefits. And what you observe here is, as I said, the future will have hospitals with no walls, which means all the hospitals will be virtual hospitals without walls. And we'll be shifting from hospital centric to patient centric. These virtual hospitals will throw a personal health navigator team. In fact, the benefits will come to you, to your door. There will be a team which will be visiting you. Continuously, you'll be monitored by the technology enabled navigator team. This is what I would like to show you. The day is not too far that every one of us will be watched round the clock for our well-being. But this is possible again, dear colleagues, only with the technology. When you look at the evolution of hospitals, on one side you can see 1935 how the hospital looked like, and 2025 today how the hospital look like. I think there's a sea of change in its construction itself, in its sophistication. Yes, inpatient rooms, yes, it's most user-friendly, and it's better than the, even the 3-star, 5-star hotels. And the patients are really happy to live in such a wonderful ambience. So the inpatient room has really changed much from 1935 to 2025. And no doubt the operating theaters today are very well advanced, technological superior, excellent, all the varieties of heart-lung machines and whatnot. Whatever is the best is available in operating theater today. So absolutely, hospitals have changed. Then inpatient rooms have changed. Operating theaters have changed for the good. However, my dear colleagues, the medical records have not changed. Still, in India, most of the hospitals do have documents. It has not changed much. In India, hospitals have changed. The operating theaters have changed. Inpatients' rooms have changed. But the absorption of IT in healthcare in the form of documentation has not changed. So it is really paining to state that this has not happened much. Still, in India, documentation is only paper. The paperless or less paper is yet to come. In this connection, I would like to introduce to you three important terms: EHR, EMR, and EHR. EHR is personal health record. Personal health record is nothing but the individual himself or herself can maintain his or her own patient record. So none else. If I maintain my own patient record, it's called personal health record. And it cannot be shared with anybody. I am the boss. I am the owner of the particular health record. There is another term called electronic medical record. Electronic medical record is a record of patients of a given doctor or of a given organization. For example, you take Apollo Hospital. Apollo Hospital is a very good automation system. They track all their patients of their own, but the data is not shareable. Neither their data is shareable with others, or they can share the others' data. Therefore, it is in isolation. So, whenever a patient health record is maintained by an hospital or maintained by a individual doctor, which is unshareable centrally, is what is called an electronic medical record. So, personal health record, I am maintaining my own health record using computer. Okay. Electronic medical record, again, is computerized, automated, but in isolation to an individual doctor or individual organization. Whereas electronic health record is the record of the patients across the globe, across multiple health organizations, which means it is shareable. This is what exactly is the need of the hour. So if we have 8.16 billion people around the world, naturally we need to have 8.16 electronic health record. So this electronic health record will contain all the data from the birth to till now. So this is what exactly is WHO is looking for. Once this is in place, I think the dream of WHO, the vision of WHO, health for all for health, is not impossible. The key aspects of EHR, I would like to just tell you. EHR, by definition, is a systemized digital collection of patient and population health information. And the important role it plays is in disease surveillance, prevention, and developing locally representative chronic disease estimates. Globally, it's worth $31 billion, my dear friends, 2024, and it's going to rise enormously, exponentially. And high-income groups like US, almost 96% of the hospitals already automate. Whereas the low-income groups like India, other countries are still yet to go a long way. Interoperability changes do come because EHR of one country, EHR of another country, within the country, we have states, within states, you have a lot of different types of hospitals, private, public. I mean, all these people maintain their electronic health record, but the question is whether they are interactable, they are communicable. It's a big challenge because majority of us doesn't follow standards, lack of standardization of formats, different EHR existing in different countries and within the country, the inside itself. Then really WHO has come here to give digital health standards. They are advocating that every country has to follow certain standards. In fact, at the end of this session, I'll be talking about the standards in medical field. Another beautiful word I would like to introduce to you, EHR is electronic health record of an individual. However, there is another word called world population EHR. This is nothing but an electronic health record to manage and study the health of entire population. There is another term called real world data used in population health management. So, it is just not electronic health record of an individual that I am interested, or I'm only interested in 8.16 billion electronic health records. However, I am also interested in understanding the population profile, demographies, disease surveillance. Everything would come provided your EHR is a world population EHR. Therein I can derive data mine any data that I would like to have. Again, looking at the economy, the digital health market In 2025, you have $350 billion. In another 5 years, you can see it's reaching $1 trillion, almost 3 times, which means a growing compound annual growth rate of 22.2%. Extraordinary growth. Therefore, the health market, digital health market, is in for a big change. And all those people who are involved in the digital health market, who work in this, are going to see a big boost in their own research life or academic life or economic life. The basic question coming to India is that do all the services rendered in Indian hospitals, be it intra or inter, meet health data interoperability standards, namely technical standards, syntactical standards, semantical standards, and functional standards? The answer is a big no. Absolutely, there is no interconnection between policymakers, providers of health, allied private entities, healthcare professionals, non-profit organizations, and administrators. Absolutely. What is desired is the EHR should be available, accessible, affordable, anytime, anywhere. This is the dream. This can happen only with the digital health. If this happens, I think, in fact, India is superpower, IT superpower. 15.76 lakh crore digital transactions happening in India. 15.76 lakh crore digital transactions happening in India. And but unfortunately, India is very slow to observe health. Even just 1% is our EHR absorption, whereas 95% is happening in India. This is where there's a drastic. India is really moving towards the top of the economy. It's the fourth largest economy. But when it really comes to other sectors, other areas, we are lacking very much behind. We have to work very hard to keep up with the world. For example, imagine that I am a patient or I am a subject, and I would like to see my ECGs across 10 years. I cannot get it today. I have to visit the hospitals. I have to give in right. In fact, I have paid the money. I have given all the money they want. Still, I have to wait in queue. I have to visit every hospital door by door. It will take 1 week or 10 days or 1 month. I do not know. Touch of a button, I cannot get my data in spite of my consent. That is very important. I am giving my consent. Still, we are not progressed because we don't have a centralized database. Like, for example, I want my ECGs, or I want epileptic ECGs of an individual or a group, or EEGs of Chennai city, or EEG of, say, Visakhapatnam. I cannot get it. CT scans with particular abnormalities. So all these are not possible today. In fact, it is said that we Indians are curative medicine is over-consumed, whereas preventive medicine is under-consumed, which is very, very obnoxious. Therefore, we have to work towards both curative medicine and preventive medicine. The only answer for preventive medicine is digital health, illness to wellness, curative care to preventive care, Q to well-being. Yeah, look at again Indian scenario. You can see that. See here, you can see there are all hospitals, there are clinical labs, imaging centers, patients, doctors, stakeholders. All of us are isolated. Still, we are not connected. No doubt, the CDAC and NIC Government of India are doing a yeoman job here. They are developing a lot of e-hospitals. ABDM, Ayushman Bharat DM, that is Digital Mission of National Health Authority, acts as a manager of these things. If you give a consent, they will be the management. They will have all this data. But however, this data is only with respect to government data. Still, they have not come to private sector. So, and also the EHR of maintenance. In fact, there are 70 crore ABA accounts created by very fundamental basic accounts. And there's a huge gap here identified. You can see that in digital health, there's a huge gap. The gaps are nothing but currently, as you know, the clinical data is stored mostly in unstructured format. It is exclusively the domain of hospitals. Neither the patient nor the doctor has a digital accessibility. Data is not clean. And therefore, applications such as data mining, blockchain technology, big data analytics, AI, ML, DL, virtual reality, augmented reality, mixed reality, AI generated tools will certainly be a distant dream. Because once you do not have any data, what is use of talking AI in healthcare? And this huge gap has to be bridged. So that should be the objective of all of us, that you really deal with digital health. And what is the way forward? And there is no doubt the only way forward is digital health. Health informatics. I would like to introduce another important term like called health informatics to you. So health informatics and digital health is the only way forward for India, because India is a huge nation with 140 crore people. So our the ratio of doctors to patients, or the number of doctors to number of citizens, nurses to citizens, hospital to citizens, facility to citizens are very, very less when compared to the advanced countries. So to close this gap, only technology can help us, and no doubt India is technologically superpower. So it's a question of time, hopefully, that India will overcome these obstacles. Now, let us go deeper into the topic. We have a term called century of complexity. What is digital health informatics? What is smart medical home? Why at all AI in healthcare? And what are medical standards? These are some of the questions that really has come to my mind, and I'm posing to you. Century of complexity, digital health informatics, smart medical home, AI in healthcare, and medical standards. All of you might have heard about a very eminent physicist named Stephen Hawking from UK. When he was asked what is in store for the 21st century, he replied that this century will be a century of complexity. You may be knowing that physics has reigned supreme in the 19th century, that is 1800s, where Faraday, Ampere, Einstein, a lot of people gave life to many things. So physics has reigned supreme in 19th century with thermodynamics, electromagnetism, Maxwell's driving the industrial revolution. In the 20th century, no doubt physics still succeeded, quantum mechanics. However, electronics have born. With electronics, computer revolution has taken place. A lot of things happened in life sciences. Genetics unraveled the human genome. So that was the 20th century. And this 21st century will have all this. But however, this will be the century of the complex system, century of the complexity. The examples of complex systems are social networks, interactions, internet, airport networks, food chains, whatnot. All are complex systems. So future will have real complexity. And also, there are major complex challenges like hunger, climate change, genetic diseases, mental health crisis, epidemics, economic crashes, corruption, disinformation. And the only solution to all these complex problems are complex systems design. So when complex problems arises, the solution is complexity in design. If you're able to overcome complex, give better complex situation, complex design, I think we are winning. And you know that digital health is the most complex system. In fact, it is said that the health business is mother of all businesses, because all the 8.16 billion or 816 crore will have health in common. Okay, whereas in all other things you can decide rich, poor, you can have a lot of divisions across these 8.16 billion people. However, what is combining, what is uniting all of us is the one term called health. And that is most complex because it involves all 816 crore people. That is why I would like to introduce the term complexity. The society now we are really going through is e-society. We have email, and then you have e-commerce, e-learning, e-governance, e-health, personalized e-health, m-health, and me-health. So all are electronics-based one. And the e-health, my dear friends, is no doubt a complex system. Transforms the doctor-patient relationship with the dose of technology. You can see the patient telling to the doctor that, oh, sorry, I'm doctor, but again, I have to disagree, because I've gone through a lot of information. E-health is the health version of e-commerce. The electronic, the E is electronic, But however, E means many things. E means efficiency, enhancing quality, evidence-based, empowerment, encouragement, education, enabling, extending ethics and equity. So many beautiful terms are associated with the E, electronics. And here are the global trends in digital health, telemedicine, wearable health, AI and machine learning, remote patient monitoring, digital therapeutics, blockchain for health data, healthcare data interoperability, mental health technology, personalized medicine, digital health regulation, patient empowerment, data security, and AI in drug. So these are all the latest trends across the world, which WHO has agreed. And when you see the objectives of our Indian National Digital Health Mission, they have really taken all these 13 points which I have stated here. It's a modern trend. No? Okay. These 13 digital health trends are totally absorbed in our objectives of National Health Mission. Here you can see again we have 13 points here, wherein the words like, say, citizen as the owner of the data, citizen-centric approach, from hospital-centric to citizen-centric. The SW is state-of-art digital system to manage core digital health data. Then you say creating single source of information, open standards by all national digital health orders to create a system of personal health record, EHR. Okay, ensure national portability, use of clinical decision-making systems, health data analytics to strengthen existing health. So when you look at the objectives of National Digital Health Mission of National Health Authority of Government of India, you will see that whatever the modern trends that has been set in across the world for digital health has been totally brought in here. Even the NABH recently has revised its modus operandi, stating that they have come with the digital NABH now. 2024, they've made everything digital. So it's a welcome change by Government of India. And now, coming to introduce you to the term called health informatics. Health informatics is umbrella. It's a total it's a superset of so many subdomains of health informatics. Dear friends, you must know there are terms like clinical informatics, medical informatics, nursing informatics, public health informatics, bioinformatics, imaging informatics, pharmacy informatics, dental informatics, veterinary informatics, consumer health informatics, then your e-health, clinical research informatics, translation research, etc. Maybe the time may not be sufficient. So when you look at this, the term health informatics is an umbrella of all these informatics. So bioinformatics alone does not represent everything. There are very many other informatics. So all the informatics together becomes what is called as health informatics. So this, I think, must get into your mind. Many of the people in India have not understood the term. There are many terms which is not brought into the literature at all. The academic has not taken at all. So these are the informatics that computer science, IT, and the electronics and biomedical engineering have to take up. They're only focusing on one or two informatics, which is not correct. We have to go for health informatics, which is a superset of all these informatics. All these informatics has to be taught as an academic course. You see here, there are so many sub-domains in health informatics, bioinformatics, clinical informatics, imaging informatics, organization issue, patient record, EHR, public health. You can see, there is hundreds and hundreds of subdivisions which we are missing in our academic circle. Coming back to the health informatics, these are the two terms, health and informatics. And let me define informatics first. Informatics comprises the theoretical and practical aspects of information. As you may be knowing, any information will have two aspects, theoretical aspect and practical aspect. So informatics comprises of theoretical aspects of information, practical aspects of information. When this information comes, I would like to introduce to you what is called as the DIKW pyramid. D stands for data, I stands for information, K stands for knowledge, W stands for wisdom. See, data, information, knowledge, wisdom. So what we get initially is a raw data. That has no meaning. And when by your algorithms, by your data mining techniques, you identify the patterns, then it becomes little meaningful. Once you derive meaningful data from the raw data, then contextual information has been given. Then with context, it becomes knowledge. And then with the practice, you can see application, it becomes wisdom. So in the knowledge, in the BIKW pyramid, you start the questions who, what, when, where, and why to a term called information. So thus, the raw data becomes information, information becomes knowledge, knowledge becomes... So herein comes all your subjects. Complete plethora of biomedical engineering, computer science, IT, electronics and communication, everything is brought in here. All the subjects are consolidated in this DIKW pyramid. For example, imagine there's a driverless car here. What you see here is a driverless car. This car is approaching a signal and there is a red signal. Red is a raw data. The car should know whether it is going to left or right, or it has to know whether to move forward. Then understanding the red is whether it's is to allow is to stop forward or left or right. Then understanding that it has to turn right, it has to take a decision, and finally, if the red color is towards the decision that the car has to move, the car has to wisely stop. So this is what is from the raw data. Just looking at the red, the car has to take a decision whether to stop or to proceed. So raw data, meaningful data, which is information, contextual information becomes knowledge, then applied information becomes, applied contextual information becomes the wisdom. Okay. So informatics comprises theoretical and practical aspects of information processing and communication based on knowledge and experience. This is what is the definition of informatics. And the definition of health, as let me put it to you, my dear friends, it's not that health of you and me alone. It's not an individual health. It's the individual of the whole universe. All levels of data and information from molecule to population. Just don't think health means it's only your health. One health. I mean, you take all life in the world, the universe, okay, and understand the universe in totality. Appreciate it. So collect all levels of data and information from molecule to population needed to ensure prevention, diagnosis, and treatment. That is a beautiful definition of health. Health and informatics. Health is all levels of data and information from molecule to population needed to ensure better prevention, diagnosis, and treatment. Informatics comprises of the theoretical and practical aspects of information processing and communication based on knowledge and experience. If it is in the field of health, it is called health informatics. If it is in the field of biomedical, it's called biomedical informatics. If it is in the field of molecule, it's called bioinformatics, and so on and so forth. So this is the definition of health informatics that I would like to introduce to you. And this health informatics is nothing but an amalgamation of all types of health sciences, clinical science, biomedical science, public health sciences, social sciences, information sciences, then all types of technology with management science. All of them together is what is called as an healthcare informatics framework. So health informatics is nothing but a very good combination of all health sciences, social sciences, information sciences, management sciences, and technological advancements. That you can see how complex the health informatics is. As an example, I have given you here three important, very fundamental informatics called medical informatics, bioinformatics, and neuroinformatics. Medical informatics is nothing but ICT. ICT, as you know, it's the information communication technology. ICT applications to individuals, citizen, patient, and population is called medical informatics. ICT application to molecule is called bioinformatics. ICT applications to social sciences and behavioral sciences is called neuroinformatics. Some of the examples of medical informatics are electronic health record, because electronic health record is for an individual, not for a molecule. Health informatics, clinical decision support, telemedicine, safety and security, everything will come from medical informatics. On the other side, you have bioinformatics, which talks about molecules, structural genomics, functional genomics, proteomics, biochip technologies, computational biology, etc. And then you have cell-to-organ informatics, which talks about biosignal analysis, neurocell technology, neuroalgorithms, machine learning, etc., etc. So a synergy of all the three fundamental, basic, informatics is nothing but health informatics. Coming to medical informatics, dear friends, is really a combination of medical instrumentation, medical robotics, bioinformatics, medical imaging, big data integration, healthcare management, hospital organization, pharmaceutical technology, e-health, government application, rehabilitation, all of them put together is what is called medical informatics. This medical informatics has 6 levels of complexities. One is the basic level is acquisition of clinical data. As you know, the first level is data acquisition. The next level is storage and retrieval. Third is processing and automation. Fourth is diagnosis and decision making. Fifth is therapy and control. And the sixth is research and development. So I repeat that Van Benmel in the year 1997 has defined 6 levels of complexity in medical informatics. The first is clinical data acquisition. The second is the way that clinical data is stored and retrieved. A lot of processes will come here. I will show you in the next subsequent slides. Processing of this medical data and automation, diagnosis, recognition and diagnosis and decision-making process, therapy and control, and finally research and development. So these 6 levels are related to our triangle that we have seen there. Okay, raw data, information, knowledge, and business. See, initially the stage 1 and 2 talks about raw data. 3 is processing, which is nothing but creating a meaningful data. Gets the meaningful information from raw data, information. Next is the knowledge, and the last one is the wisdom. So this is how the 6 levels of medical informatics and the DI, KW triangle is related. Now let me quickly go through the 6 levels to make you, because most of you are the electronics engineers and computer IT engineers. You should understand what does each level mean. Data acquisition and communication means collecting all biomedical data. See, you have ECG, EEG, and electrical signals. Different formats, different media of data. See, this is electrical in nature. You have PCG, which is acoustical in nature, and you have blood pressure, oxygen saturation, telemedicine, temperature, respiration rate, all are non-electrical signals, and you have plethora of medical images. So when you look at the human body itself is having multimedia clinical database. You know, all types of databases available in your human system. So this is at the first level. This is a whole system I am showing you. I think most of you know this. Let me not invest most of the time here. Obtain the biosignal. The first level talks about only this one, biosignal, acquisition of biosignals and little bit processing. Okay. And then the stage 2, 3, 4 would come. When you come to imaging, again, it's a huge one. As you see here, there are a lot of images. So these images are obtained from different modalities, say CT, MRI, PET, ultrasound, X-ray, hybrid modalities, and for various applications. So acquisition of, electrical signals, clinical electrical signals, clinical non-electrical signals, and then PCGs, and then obtaining, the images is what happens in level 1. Not only this, today you are having a word called IoT, Internet of Things. There are infinite things in the world, and these things, when connected to internet, they are called Internet of Things, as simple as that. Fan is a thing. When you connect the fan to an internet, it becomes Internet of Things. Switch is a thing. Okay. When you connect internet, you give the facility of connecting to internet, the switch becomes Internet of Things. Like this, I can list infinite number of things in the world, and if this internet things is connected to internet, it's called Internet of Things. And there are again subdomains in this Internet of Things, which are called Internet of Everything, Internet of Anything, social Internet things, web of things, industrial Internet of Things, and finally, I am more worried about Internet of Medical Things that I would like to introduce to you. This Internet of Medical Things have 3 layers. These are all happens in the medical informatics first level. Sensing layer, where you have the patient, sensors, and the data is acquired. Through Wi-Fi, it is sent to the cloud access point, or through you have the Bluetooth or the Zigbee. Then you have the base station, and in IoT cloud, you have data analysis, database, data cleaning, Raspberry Pi, and finally the end user. These are 3 layers of internet. And when this internet 3 layers are used for medical purposes, it becomes Internet of Medical Things. You can see that hundreds of medical things are there, and hundreds of medical things are connected to internet. It's called Internet of Medical Things. As an example, to make things very clear, I have shown you some monitor of all. This is the centralized one where you get data from smart wheelchair, wearable devices, physician, health apps, ambulance, whatnot. So this gets data from all corners of the world, and it can maintain through IoTs. I think then it's fine. It's an IoT, IOMT. And IOMT has wide range of applications. I can see medical in the sports performance monitoring. You have in-body electronics, on-body electronics, off-body electronics, or a combination of hybrid of all these things. So you can sense a lot of ECG can be picked up, and under skin glucose glucose can be monitored. Then your temperature can be monitored, heart rate can. I think what not. IoT has become a boom for all of us in this century. These are all things that happens in level 1. When we come to level 2, which is storage and retrieval. Yeah. Storage means storing the text data, storing the acoustical data, images, videos. And here in comes the standards, HR7 standard, HIPAA standard, DICOM standard, lining standard. And this raw data also, as you know, needs compression and decompression technique, because the data is very huge. You have to go for compression techniques and decompression techniques, encryption and sorry. Raw data needs compression and decompression for storage, encryption and decompression panel, steganography is there. So when we want to store data, what you acquire from the system is a raw data. Raw data is always uncompressed. This has to be compressed, and whenever you want to work, you have to be decompressed. And this has to be encrypted and decrypted. And herein comes the big data analytics, because 8.16 billion people means 816 crore world population means you can imagine. Even if every individual have 10 sensors in the whole body, 8.16 billion into 10, 81 billion sensors will be there. Imagine the mind-boggling data that is needed. That's a big data. Then cloud computing, data mining, data storage medium. You just imagine all the problems associated with this kind of storage. Some of the examples from digital storage medium, magnetic storages, optical. Why I'm showing all this is there is a job for everyone to do. If you look at the 6 levels, job is available for electronics engineers, biomedical engineers, computer science engineers, IT engineers, and for every type of engineering, we have all the jobs available in the 6 levels. And this health is health business. That's why I said this is a century of complexity, and health is no doubt the most complex system in the world. That's why I've taken this topic called digital health. Again, when you go to storage, you have file extension, because when you store something in a document file, you store it as doc or docx text. When it is an audio and video, you store it in MP3 or FLV, MP4. When it's an image, you have GIF, JPEG, etc. And when it comes to medical images, it is stored in DICOM format. I'd like to tell you on that. And then web and executable files, which means storage. And you want to really understand, you have to understand all kinds of file extensions that are available in the world currently. Common biosignal file formats are European data format, which is called EDF. General data format is an improvement over EDF. And then WFDB, which is using a PhysioNet, which is for research purposes. And then MFER for medical waveform format encoding. Why I'm telling all this is that as a practitioner of medical field, as to understand health informatics, you have to understand how these files are stored. That is, there is a header, there will be a body, there will be a tail, and how these are stored. It's a big understanding knowledge. It's not that easy. So you have to understand how ECG is stored, how EEG is stored. For example, EEG, ECG, EMG are stored in European data format or GDF format, or sometimes MFER format, which is used in Japan. Proprietary formats are also there, which is Siemens or Philips. So each manufacturer has their own format. Therefore, these are some of the common biosignal formats which are paid and open sources. I think you got it. These are some of this is a table which gives almost every biomedical format. So you see EDF, European data format, EBS, extensible biosignal format, FEF is file exchange format, HL7. Yeah, all these things are available here. Coming to images on the other side, we have seen the electrical signals, and images also should be stored. And you see the modality of images, then the anatomy, then image dimension, and the bit, the depth of the information, and uncompressed. For example, you see radiography needs 10 MB. Imagine there are you take 8.16 billion people. That is 816 crore. 816 crore. If all the 816 crore people take one X-ray, which occupies 10 MB, you just calculate the amount of memory you need. Imagine that every person in the world at least goes once or twice or 10 times to a hospital. And if I want to store this data, both clinical, say, biosignals or medical images or clinical laboratory messages, I think the amount of data storage medium required is enormous. Enormous. Okay, that's why I wanted to introduce this particular table to all of you. You see the kind of data that is really available in medical field. You have every data, ECG, X-ray, blood bank, then blood bank, then catheterization, blood bank, pathology, laboratory, so many things are there. And this is a real relational database management system for 8.16 billion citizens of the world. So I'm imagining like this. This is one picture, but I'm looking for similar data. This for one individual. For one individual, throughout his life, so many data would come to a centralized point. Similarly, imagine 8.16 billion people data. And this data will be distributed, as we see here. So the data can be collected from a home automation, or from a school, or from a clinic, or from a prison, or from a company, battlefield, or from hospital, or from moon, or from Mars, anywhere an individual be. So data can be collected from any point on Earth, at any point on universe, and stored it centralized as a distributed medical information system. So such a system is deployment of a real-time, scalable, distributed multimedia, real-time database management system, digital health platform for 8.16 billion citizens of the world. I always refer 8.16 billion because that is the seriousness with which we have to deal with this subject. See, 8.16 billion people, data has to be coming from wearables, consumer data, registries, electronic medical. I think this is the real world data. Please recall, just 20-25 minutes back, I was talking about EHR, population EHR and real world data. This is the real world data that you must be understanding. So always, when you say medical data, say 8.16 billion people. If we talk about India, say 140 crore people. And not only collection of data, not only storing. When you retrieve the data, I need a format like this, wonderful reporting format, where I should be able to get data chronologically, date-wise, and then modality-wise, signal-wise, for an individual, for a group. I think with 8.16 billion EHRs and the kind of queries that you may come up with, this system should be able to give answers. Herein comes the beautiful concept called AI, fuzzy logic, pattern recognition, whatnot. All technologies of today is coming here to data mining is fundamental here, getting relevant information and posting to you so that the doctor can really understand the past history. You have to collect data from past history. So this is called healthcare data analytics visualization. So this is also very important. Storage, this is a retrieval, that is collection of clinical data, then storing of clinical data, retrieving of clinical data is that. So with this, I think perfect real-time telehealth consultancy is possible. I may be in place X, my data may be in place Y, it can be in place, the radiologic center may be somewhere else, clinical lab, doctor, all the 8.16 billion citizens data is centralized here. Here is the patient, here is the doctor. So doctor and patient can interact with each other. The doctor can say every data of the patient because with the permission of the patient, he is able to access his full data right from his birth. Everything is available in his tip. Therefore, diagnosis is very. It's a live consultancy, even by real-time vital signs, because this patient will be connected to a real-time vital sign monitor. So his body temperature, vital signs are measured on live. In addition to patient history, medications, allergies, lab results, etc., etc. This is what is true live teleconsultancy system means. So this is what health informatics means. Digital health means. So when I say 8.16 billion people with so many things, this then automatically the word big data analytics comes into picture. When you say big data, see long back 2013, it was only 153 exabytes. All of you might have heard about a term called gigabyte, 10 power 9, but that is too small to talk about big data. Today, people are talking about exabyte. Exabyte is 1 billion gigabyte. That is 10 power 9, another 10 power 9. 10 power 9 times 10 power 9, which is 10 power 18. So exabytes. People say that the healthcare data is 153 exabyte was in 2023, and it would be 2,314 exabytes in 2020. But the space available is only 985, around 1,000 exabytes. So you can see the demand. I mean, it's very huge. Data analytics is the subject of the future. Data analysts are very important for the future. And health is the mother of all business. Okay, $44 trillion. And when you see the size, another beautiful term I would like to introduce. Before that, let me tell you, 1 gigabyte is the size of an earth, whereas 1 exabyte is the size of the sun. Now you can imagine. So we will not be talking about a gigabyte in future. We'll talk about the exabyte. Even exabyte is becoming smaller because of the data that is growing like a big, huge demon. Therefore, a new word has been coined as zettabytes. Zettabyte, 1,000 times exabyte is zettabytes. So 1,000 exabytes is called zeta, which means 10 power 18 into 10 power 3. So 10 power 21 is 1 zettabytes. So in the year 2020, we have seen that it is around 10 zettabytes. Whereas in 2025, it's 50 zettabytes. I think it is extraordinary growth. I mean, the database is growing, cloud computing is increasing. And when you look at the economy of this, market value of this, the big data analytic market has changed from almost, see, $50 billion to 1,125, almost 3 times in just 5 to 10 years. Then you see the cloud computing market. It has just moved from, say, a mere $74 billion to $286 billion. You can see in every 5 years, absolutely everything is triple. 3 times things are changing. Therefore, digital health informatics is the most important topic of the future because we have to move from cure to wellness, preventive care. There are 6 characteristics of the big data, which are called volume, velocity with which you are collecting data, variety of data, variability of data. Variety means just a multimedia data. Variability, within each data, there will be a lot of variability. Veracity means authenticity of the data. Then you have value of the data. These are the 6 characteristics of big data analytics. And then the impact of big data in the healthcare is improved patient care, personalized medicine, predictive analysis, enhanced clinical decision support, operational efficiency, accelerated research, remote patient monitoring, and population management. These are 6 ways that your big data can transform our lifestyle. Yes, throwing light on medical practices, prevention, prioritization of global public health, support to providers, genomics and beyond diagnosis tools and treatments, improve data communication and quality, enhance the efficient care, and better health and data. And these are the 6 ways that big data, which means big data in health is a very, very important tool in future. Also, you have 5 types of healthcare data analytics technologies. Yeah, you have 8.16 billion EHR. Then you have artificial intelligence as one of these 2, cloud computing, blockchain networks, health information technologies, and machine learning. These are the 5 important tools that are available. 6 real-world applications for your kind information is the research on cancer, conducting early detection, improving patient care, delivering telehealth services, then removing bias for better outcomes, managing financial risk and the others is a 6 real-world applications example. Then coming to cloud computing, as you see, cloud computing is software as a service, platform as a service, infrastructure as a service, and this cloud computing will play a vital role in health informatics. Healthcare cloud will include every information from every stakeholder, from a doctor, from family, from authority, whatnot, from everybody. The information will go to care. I have shown you the 3 layers of IoT. Okay, the 3 layers of IoT will have as a central layer healthcare cloud. So healthcare cloud is going to play a very vital role in healthcare informatics. Data mining is another important, beautiful term that we have to come across. Data mining is nothing but you have infinite raw data. As you say, the first level in our DIAW triangle, the first is the raw data. Raw data has no meaning. From the raw data, you have to derive some patterns, uncover patterns and other valuable information, because to make it more informative and meaningful, you have to convert the raw data into meaningful data. So data mining plays a very important role in this. Patterns are handcrafted or made by individual, then it's called machine learning. If it is done by the system itself, it's called deep learning. That will come in the next few slides. So data mining is a very important technology, machine learning algorithm, to uncover patterns and other valuable information from large knowledge base of discovery of databases. Blockchain technology, again, blockchain technology talks about the security. HIPAA is an important standard in this connection. Security means all the data. You have seen 8.16 billion people's data. You have to store it very secure. No mistake has to be done. Then only I will have confidence in the system. Therefore, blockchain technology is an important technology that all of us should be aware of. So blockchain is a decentralized digital database, a ledger that securely stores records across network of computers in a way that is transparent, immutable, resistant to tampering, because here it is not a single point of transferring. You have to make use of so many people. So many people has to come together so that a single data can be taken. So most safest way of storing healthcare data is block technology. And again, when you go to the blockchain market size, see, 50% it has increased over a few years. CAGR of 50% is unbelievable, unimaginable. So 2025, it is 5.5 billion. Today, it's almost 50 billion. That is the kind of market that is being developed in healthcare. The multiple ways by which blockchain technologies are revolutionizing healthcare is improved data security, data monitoring, clinical trials, drug safety, then smart contracts, claims and billing management, interoperability, and facilitating monetization of health data. These are all the important ways that healthcare technology can be revolutionizing healthcare. Benefits naturally enhance data security, interoperability, visibility, fraud minimization, and automated and efficiency. These are all the advantages of blockchain healthcare. These are all the things, my dear friends, at level 2. We have not even gone to 3, 4, 5. First is acquisition of clinical data, both electrical, non-electrical, and imaging. Second level is storage and retrieval. So many things, so much technology is involved here, so much job opportunities are involved here, so much academic interest is involved in this level 2. When you go to level 3 in medical informatics, processing and automation, I need not tell you. Processing automation, biosignal processing, medical imaging and processing, application of relevant algorithms, extraction of statistical morphological features, creation of expert knowledge domain. These are all the things that is involved in level 3. Let me introduce some of them. See, first is a structure, converting data, unstructured data into a structured data, then storage, processing, and then auto actionable insight. This is the process. And this is a typical biosignal processing, as most of you would have been familiar with this kind of block diagram, biosignals acquisition. Then you have the sensors, isolation amplifier, filtering, analog digital converters, then signal processing, post-signal processing, diagnosis, all these things happen in level 3, processing and automation. When you take up further, you deeper into the biosignal processing, you have pre-processing, then you have basic statistical parameters, time domain analysis, multivariate analysis, frequency domain methods, non-linear chaos and complexity analysis method, and classification. When you want to be very good in biosignal processing, my dear friends, you have to understand all these things. You can become a master in biosignal processing by understanding all these algorithms. Similarly, when you go to medical image processing, you have the terms like medical formation, registration, medical enhancement, medical visualization, medical analysis, medical image management. So I think the words like feature extraction, segmentation, classification, illumination, shading, compression, retrieval, I think all these things would come when you want to become expert in medical image processing. As a medical imaging teacher, a faculty, all these words you'll be familiar with. When you come to feature extraction in an images, yes, shape-based features, area, perimeter, circularity, irregularity, intensity-based features, mean, variance, standard, these are all statistical features. When you go to texture-based features, you have contrast, correlation, entropy, nonlinear features. I think in medical imaging, you have so many beautiful things. These are called feature extraction. This is what is from the raw data, you are extracting features. From the raw data, you are getting information. From the raw data, you are getting meaningful contextual information. So this is level 3, which is called feature extraction. If these features are handpicked by individuals, it is called machine learning. If these features are extracted and the decisions are taken by the system itself, then it's called deep learning. And under medical imaging, to make things clear, you have image acquisition, pre-processing, segmentation, registration, feature extraction, classification, visualization, and lot of algorithms like this. The important words like acquisition, reconstruction, enhancement, analysis, visualization, management are part of medical imaging system. There's a typical example to make things very clear to some of those who have not been in this field. Yeah, you have an input image, feature extraction, image patches, machine learning, deep learning, and then identification, the end result, whether it is a cancerous or normal or abnormal, or benign or malignant. So this is a simple imaging algorithms. These are all that happens in level 3. Level 4 is decision-making and diagnosis. All that now you have collected the data, you stored the data, you retrieved the data, you processed the data, and you automated the data. The next level is decision-making data. What to do with this data? I have to identify whether it is normal or abnormal. I have to identify if it's benign or malignant. So recognition, decision-making takes place in level 4 of medical informatics. Using knowledge such as pattern recognition, neural networks, fuzzy logic, neurofuzzy, artificial intelligence, and machine learning, deep learning. I quickly go through them. So here you're able to see, an unsupervised system, supervised system to really identify the cancer detection, and conventional machine learning system. Yes, convolutional neural network, what I have shown here. Many of you might have been working in this. It's only an example that I'm trying to show. You have an image and you get the output. And this is what is happening here. You have, a machine learning algorithm. You have the input, training. This is a training and this is a validation. So training, you have the neural networks, and then identify them, find out the, compare the reference, estimate, error, adjust, back propagation, do this continuously. This is what is called training, and get the result and do validation process. This is what is happening here. Now, the role of AI in healthcare. This is the beautiful picture that I'd like to show to you. Machine learning and deep learning are subset of AI. AI is emulation of human being. Its own intrinsic talents, and this artificial intelligence, the subsets of machine learning and deep learning. This is what I would like to tell you. There are 2 terms called, 4 terms, let me say: input, output, feature engineering, and classification. If this feature engineering is done by human intervention, it is called machine learning, which means extraction of features. I have given you a beautiful table there, extraction of feature extraction, and what features you are going to use for decision making. If it is done by a man, human intervention, that is called machine learning. Subsequently, everything is machine based. If these extracted features, which features are selected suitable for the decision making, is decided by the machine itself, it's called feature learning plus classification. Then it is called deep learning. So this is an introduction to you. It's a traditional machine learning. This is deep learning. Is an embedded system. You can see. Okay, the machine itself take all the data. Traditional machine learning techniques, and my dear friends, you have machine learning. You have supervisory learning, unsupervised learning, semi-supervised learning, reinforcement learning, under supervised learning. You have so many classifications. Then there are so many algorithms. I think, my dear friends, if you can go through all these things, you will become masters in machine learning algorithms, which is very, very important for a data scientist. Then deep learning or auto-encoders, convolutional neural networks, long short-term memory for vanishing gradients and memories. I think for every problem, there is a solution. Feature extraction, noise reduction, you have auto-encoders. Text qualification, you have transformers. Synthetic data and model generalization, you have GANs. For recurrent neural networks, for speech processing and whatnot. So these are some of the techniques that are used in deep learning algorithms. Here is a summary of algorithm. You have AlexNet, BGGNet, RESTNet, GoogleNet, MobileNet. All these are for really recognizing handwritten and machine. See, for LeNet is for handwritten machine printed characters. Large-scale image networks are recognized by AlexNet. Improved version of AlexNet is ZFNet. BGGNet does wonderful accuracy with the large-scale image recognition. I think you can go through this table. I'm leaving to you. And based on your need, you can choose the type of net you have. And you should also understand important terms like the size of the input image, whether you are going for CNN or RNN, then the number of filters you want to choose, the term called stride, max pooling, average pooling, filters. I think, my dear friends, you should know all these different terms. You should be very familiar with these terms so that you can become an expert in deep learning. This is another example for deep learning, VGGNet architecture. Then you have UNet, very important for image classification. ResNet, 18th architecture, ResNet. Then you have DenseNet architecture. Then you have GoogleNet architecture, MobileNet architecture, where embedded mobile phones can really recognize the images given and classify them, intelligently give information of the image. The mobile net. See, again, to become very familiar with this nets, AlexNet, Google Net, ResNet, DenseNet, and mobile net, you make a table like this. How many layers are there? What is the size of the image? And what's the size of the image as you move from one layer to another layer? What is the output size? What type of kernel you are choosing? What type of pooling you are making? What type of stride you are doing? All these things, if you make as a table, I think you will really win your basis of some things like this. Then you will really be confident of using any net of your choice. Level 5 is therapy and control. Yes, once you identify the problem, you can be given a tablet or some medicine or some injection or some chronic diseases or sometimes surgery, whatever be it, therapy. Then research and modeling, that is what, as people in academics, we are doing, completely devoted to, research and modeling. These are the level 5 and 6. So this is what is medical informatics all about. There are 6 layers of medical informatics. I have really explained them. If you want to work in medical informatics, this is what is expected. When you come to bioinformatics, yes, it is a combination of engineering, biology, chemistry, computer science, molecular chemistry. Then you have taxonomy, biochemistry, a lot of things, all biological sciences. Okay, put together, it's called bioinformatics. Clinical informatics is another important term, which means clinical informatics is the interdisciplinary field that applies information technology to clinical care management. That's a very important term because you have to manage your hospital sector. You have to do service to the patient. So caring the patient and managing the patient is an important area. This is what clinical informatics attempts. So clinical informatics is the interdisciplinary field that applies information technology to data analytics to healthcare and improve the patient care. That is very important. Improve the patient care and outcomes. Then you have medical imaging informatics, how the medical images from various modalities are stored. Here you have the word called RIS, Radiological Information System. You can see here. See, this is a modality. Collect the image, put it in a picture archiving. This is a PACS archive. And from here, that is always the data, the images doesn't straight away go from modality to the doctor. Modality to PACS, then through RIS, images are given to the doctors for further analysis. So what you have to understand is medical imaging informatics needs 2 important terms, PACS and RIS. And connecting them is HIS, which is called Hospital Information Systems. So this is what is expected, my dear friends. And this is called medical imaging. It's a huge field again, medical imaging informatics. Nursing informatics, yes. The domain knowledge is nursing here, nursing science, information science, computer science. Nurses do a lot of help to disabled, rehabilitation care, change of dropper, nutritional support, vision test, nursing staff, drug delivery. They have their own management, their own courses. So management and processing of nursing data, the delivery of nursing care is nursing informatics. Consumer informatics is individual concern, like you and me. We are all individuals. On the other side, we have the providers, we are utilizers. We too have our own rights. So consumer rights are there. Patient rights are there. To bring this awareness, we have consumer health informatics, which is legally today is available. Consumer health informatics, CHI, is subspecialty of health informatics that uses electronic information and communication technologies to help individuals make informed health decisions through mobile apps and online portals, and also provide access to personal health information, promote self-management. Dependence on self is more important. That's what empowering patients. Empowering patients is very important. That is what is very important for preventive health. 24 hours, you cannot expect a doctor to guide you. There must be technology to guide you. So individual in combination with the technology should take care of them. So that is what is consumer health informatics talks about. This is healthcare, clinical informatics, and consumer informatics. Public health informatics is another important term that you should know, because all these are sub-domains of health informatics. Please understand. I'm discussing informatics isolating individual, but all of them together is what is called health informatics. Public health informatics is at a government level, not at an individual level. Government wants to know what is the problem, what is the cause, what is the disaster that has happened. COVID is a big disaster, and how do you mitigate it? How do you do it? Problem is COVID. How do you respond to it? So for this, you need a full database, public health approach. This is what a study on this is called public health informatics. Surveillance, risk factor identification, intervention evaluation, and implementation. These are the 4 important subdomains of public health informatics, from problem to response. And public health core sciences involve prevention effectiveness, epidemiology, public health, surveillance. So this is what is public health core information. And I'm introducing you to your smart home. Okay, finally, I want my home to be smart, because we are moving from hospital to individual. So smart home, you have face recognition, you have smart sprinklers, you have lighting control, you have climate control, your door lockers automatically, as soon as you enter, it will open by your facial recognition. Then you have automated blinds. You can see the blind automatically, when you enter, it will open, it will close depending upon the sunlight. Lights will be on. Robot vacuum cleaner, the moment there is a lot of dust, automatically robot will come out and it will clean and go and get settled in its own place. Lawn mower. Then intelligent entertainment. If you sit before the TV and think that, yes, I have to see some movie, automatically that movie will come there. Intelligent entertainment. Intelligent appliances. Yes. Refrigerator, washing machine, all of them will talk to each other. Fan will talk to refrigerator, refrigerator will talk to mobile phone. I think they'll become, this is what is called Internet of Things. There are hundreds of things in your home. If all of them are connected through internet, they are called Internet of Things. And remote site monitoring, from remote you can monitor your home. See, a simple kitchen has so many sensors. So many sensors. That's why I told this big data analytics. Tomorrow, your wife, the spouse, may set the password for your stove, and unless you know the password, you cannot switch it on. You cannot make a tea. So you will need your password if you want to make some toast. Smart, yeah, I have been talking about smart home now. Let me talk about smart medical home. So nowadays, each home is becoming medical, individualized. So ECG can be monitored at your own home. Then wearable textiles are there. Just wearing the textiles, your ECG, so many things can be monitored. All body check, yeah. You can buy this, and daily you can find out your body mass index. Full body sensors are available. When you sleep on the mat, on the bed, yes, your sleeping patterns can be analyzed. Whether your pressure level can be displayed here. You can see the pressure is collected and shown here as a pressure image plot is there. Okay, sleep disorders can be identified. Your home will be having smart floor. If an elderly person falls down, it will be detected, and information will be sent to you. Also, information will be sent to the navigator. I have shown you the first picture. Automatically, the people around, the people who will be taking care of your family will come and help your parents who may be at home alone. Before you know that what has happened, you'll be very happy to know that the people from the doctors from nearest to has attended. Because all these are possible through internet. Your restroom will have mat. This mat can give you warm temperature. This mat can give you the body mass index. This mat can give you so many things, so much information. So smart restroom. Then ambience, room ambience. So if your body temperature reduces, automatically the heater will be on. More heater, then AC will be on automatically. If you have a body glucose monitor, if glucose goes level, refrigerator will say, Mr. Victor, your glucose level has come down. Please have a cup of juice. So apple, you can go and have a cup of juice. He'll be given that guidance. The moment he has apple juice, automatically when he goes for urine, then the sugar level might have increased. Then you have a smart toilet. The toilet will be capable of analyzing urinary test, blood sugar levels, body weight. Why not? All these things. So the moment the sugar level has increased, again information will come to vector that, yeah, you're taken more apple juice. So that is a smart home. medication reminders. I think thank you for your attention. Another 15 minutes, I think I'll be completing. So interoperability is the last phase of my lecture, another 5 to 10 minutes, then we'll have 5 minutes for discussion. Interoperability is a very fundamental thing. Transport of data, information, knowledge over time, space, context, community, culture is what is called interoperability data. So over time, over space, over context, community, and culture. So this is what is called e-health. Needs many shared points of reference. Okay, trust is fundamental. Without standards and standard organization, there are no shared points of references. Yes, the final leg of my lecture. Yes, health data standards, health informatics standards. There are 4 important subdomains. You have terminology standards, content standards, transport standards, and private security standards. Terminology standard is ICD-11, for example, International Codification of Diseases. You have thousands of diseases which are codified. Okay, so ICD-10, that's NOMAD. Yes, that's a wonderful concept. Then you have transport standard. When you want to transfer text data, you have to use HL7. The modern version of HL7 is FHIR. When you want to transfer medical images from one point to another point, you have to go for DICOM. So these are all transport standards. Content standards, yeah, you have CCDA, then HL7. Then privacy and security standard. In USA, they follow HIPAA standard. In European Union, they follow GDPR standard. In California, they follow CCPA. So when you go for health informatics, software has all these standards, terminology standards, content standards, privacy and security standards, and transport standards. This is exactly, see, please observe, it's a very important slide. See, you have the centralized medical data, which I was showing 8.16 billion data, imagine. So now when clinical labs are connected, when the data from a clinical, suppose you have given your blood, the blood profile data has come. If you want to send this clinical data to a repository of medical data, you have to follow LINIC, SNOMED, and FHIR. Okay. If from imaging, suppose from Bharat Scan, you want to transmit data to a centralized database, you have to follow DICOM standard, IRMA standard, RADLX standard, SNOMED standard, and FHIR, which is part of HL7 standard. If from any hospital you want to transmit to the centralized data, again you have to follow all these standards. From doctors, you have to follow all these standards. From patient, insurance, other companies, you have to follow HIPAA standard or ICD-11. Which means I have given here a full set of medical data emanating from various resources and reaching the repository of medical data, which will be in the cloud, which will be holding 9.16 billion people's data. But in this process, you have to follow all the standard, LINIC standard, ICD-11 standard, DICOM standard, IRMA standard, then you have RADLX standard, then HIPAA standard. So many, these standards are to be followed. This is for hardware, my dear friends. If you want to design a hardware, if you are designing a ventilator, then you have to go for collateral standards, then particular standards, pseudo collateral standard, component standards. The idea is that when you design a hardware, you need components. You need a resistor, you need a fuse. Then the question is, when you need a battery, the question will be whether you have followed IEC 6086 standard. Then when you go for a fuse, then I will ask whether you have followed IEC 60127 standard. When you use a capacitor, I will ask whether you have followed IEC 60384 standard. Then when you design the system, I will say whether you are EMC compatible, 6601. This EC 6601 is called the safety standards and the essential performance standards. Then I'll ask whether your device has passed all the tests regarding to risk management, whether your system is having any home use. If you are designing a BP, blood pressure measurement for a home application, then I'll ask whether your system has passed IEC 66011. So these are all collateral standards. This is 66011 is general standard. Then particular standard is particular equipment, X-ray, ventilator. Then you have incubator. Every individual medical equipment has its own standard prescribed by BIS, that is the Bureau of Indian Standards. You have to go to that and understand it. So this is a combination of all these things: collateral standards, particular standards, pseudo collateral standards. Here again, you can see IEC 62304 is purely for software. Please make a note of it. There are two standards. This is very important with respect to health informatics. IEC 62304 is for software only. When you have a software embedded in a hardware, okay, a microcontroller program embedded in a microcontroller, then it's called IEC 82304. So semi-collateral standards. So when you design a hardware, when you design a software, you have to go through collateral standards, which is called IEC 6601, because CDSCO will approve. See, BIS will give you technical specification. So whenever you want to design and develop and market a ventilator, the technical specification will be given by BIS, which you can see from particular standards, and you have to satisfy all these conditions. Then to release in the market, you have to go for collateral standards. You have to pass all your safety tests and all your essential performance tests. And then you have to meet software standards, embedded software standard, IEC 62304, usability standards, component standard, and then IT and audio standard, risk management. So this is what is that. Kindly, there's a lot of material available on IEC 66.1. Kindly go through them. And finally, I have given you the levels. You have the TRL levels. 9 levels given in TRL. Okay. These 9 levels are ideation, proof of principle, proof of concept, functional feasibility. What I have done is for your kind information. In these 4 levels, ideation, proof of principle, proof of concept, and then functional, I have given the standards. See, for example, the first level, you have to go for biocompatibility standard, ISO 10993. This is very important. Because when you are working in ideation, that is the TR level 1, 2, 3, 4, you must know you are going to choose a material, whether that material is compatible with ISO standard. Okay. Then you have a critical standard, because all the components that issue should be compatible with the critical standards. Then technical specifications from BIS to be accepted, audio standards. Then software standards, just now we have seen, SNOMED, CT, ICD-11. So in the first four, you have to go through all these standards. Then comes the 5th level in TRL, which is called preclinical standards. In preclinical standard, my dear friends, you have to accept IEC 601, then 101. You have, that's called manufacturing standards. You have IEC 1491. So a lot of things are there. You can see IEC general standards, particular standard, collateral standards, critical standards. Okay. Preliminary findings confirm that device is equal to predicate. Yeah, all these things are there. You can go through them. And then pilot studies. Yeah, here is very important, because any medical device that you have developed first should be manufactured in an IC Med 13485 facility. This is very, very important. Okay. This is very, very important. So any medical device that that is the medical device that you are developing in a prototype cannot be given for validation. ICMR will not accept. So if ICMR wants to accept your device as correctly validated, you should give to the validation center a device that is manufactured with a manufacturing facility with a certification ICD Med 13485 plus. And also you should have environmental clearance. So these are all the things. So IC Med 1348 plus, process functioning standard, EVS disposal. Yeah, there will be a lot of EVS. This is very important. It's got R2 series standard. Okay, this is very important. Clinical studies and the pre-commission studies, all these are standards. So I will repeat that there are 9 levels: ideation, proof of principle, proof of concept, functional feasibility, which will attract the standard that I have given here. Pre-clinical standards, yeah, these are the standards which will attract, which will approve, which then only will get approval from CDSCO. Then pilot studies, yeah, pilot studies means it should be from a manufacturing facility certified by IC Med Plus, ISO 9001 facility. Then occupational safety standard 45001, manufacturing facility, so on and so forth. And then energy management. I think all these standards would come. This is what I like to information to you. I think I am done at this point. So imagination is more important than knowledge. Okay, you should be open-minded. If a lot of information, I have only touched the tip of an iceberg. Okay, there's an infinite information available in the library. Kindly go and collect them. I hope now I have given the pathway. Okay, I hope you are prepared now. Excitement is just beginning. Technology will not be our limitation. We are limited by our own imagination. And I'm leaving you at this point of time. I'm throwing you into a big water body surrounded by a lot of crocodiles. The crocodiles are not crocodiles, they are all challenges. So this 1.5 hour lecture that I have given should have created a lot of questions in you, because it is not the answer that enlightens you, it is only the questions. So if I have stimulated hundreds and thousands of questions, like hundreds and thousands of crocodiles, I'll be the most happiest person. I hope any discussion, queries, questions. Yeah. And these are the beautiful sights of India: Mount Kailash, beauty of Kashmir, the beautiful Ganga, the lifeline of India, Ganges, Western Thar Desert, God's own country, Kerala, confluence of cultures, the great Tamil Nadu, Sangam literature, the wonderful India with all its excellent temples, okay, cultures, amalgamation of, I mean, so many things in India. You cannot find a country in the world like India, okay. Customs, tradition, etiquettes of Indian culture is marvelous. Thank you very much. Yeah. Any questions from your side? Hello. Hello. Any questions?
So participants, if you have any questions, you can ask.
Yeah. Hope I match your wavelength. Lot of information anyhow, but that's the field of health informatics. Yeah. Any questions from the side or any suggestions, please? Yes, Deepak. Deepak, Narendra, kindly ask any questions, any clarification you want. Babu is there. Jay Shanti, a lot of people are there. Good. Hope this 1.5 hour has benefited you. And any clarification on this topic, you can always meet me. You can call me at any time. If no questions, yeah. Any feedback? Sorry. Hello. Hello, Babu. Nishanti.
Hello, sir.
Yeah, please.
Yeah, sir. So when you said about all this, data collection and storage of all the data, all the health records, I think
Yeah.
there's always an
Yes, Nishanti.
leakage, breach of data. Data might be breached. Health records might be stolen.
Yeah, that's why I said
What is your take on that, sir?
we have to go for blockchain technology. I referred 2 or 3 slides on blockchain tech. Blockchain technology is the most safest way of storing data.
Okay, a tangent question to this. Even like with blockchain technology and available, we do still have breach of other data and all. So what is your take on that, sir?
See, other data breaching is there because of little bit of compromise here and there. That should be avoided. See, this is not possible in USA. Correct. It all depends upon the seriousness with which you take the matter. If you are very serious about non-breaching, it is possible. See, do you have your money safe in your bank?
Yes, sir. Yes.
Yeah, if that money itself is safe, then the question of data doesn't arise. It all depends upon the seriousness with which you undertake the job. It is possible, not impossible. And only with this, I think as a patient, Nishanti, tomorrow, if you want to access your own data, see, at least 4 or 5 times you might have gone to hospital. Where is your data now? Can you access your data? Impossible.
Yeah, yeah. Like now with Doctor C and all having records of what happened, like a blood test report
Correct.
6 months back, 1 year back. It's actually helpful to have a
Not only that,
record of what has
Nishwanti,
happened.
we have given money to. It's not a free of cost. I'm asking. I have given the money.
Yeah.
I have given
Yeah.
money, 5 lakh rupees for a particular surgery, but that data is not coming to me. They are not giving, saying that the data will be. It's nothing like that. I am an individual. I am a citizen. I have given the money. I have right to access my data if I give my consent, not without my consent. Okay.
Yes, sir.
Mindset has to change. Just stating that breach will happen, how long you'll be saying this? The world has gone a lot of forward. Correct. Healthcare also should take cue and be confident to handle the data. Otherwise, the talking about AI in healthcare, machine learning are all just dubious. Nothing will happen because data will not be available to you. Can you get data today in any hospital?
No, sir. No.
Then absolutely we are unable to access any data. Then why talk about AI? And all these things are very dubious. Yeah, that's good. No, fundamentally, healthcare finally comes with the data only. India can develop only when this data is stored safely, very safely, and given to researchers. The medical data, excellent medical data is available, Nishanti and others. See, every month we are having 1 lakh or 10 lakh medical images across India, not 1 or 2. Just understand. Every day we have 10 lakh plus medical images being taken across India. What happens to the data? Not even one single image comes to me as a researcher. Understand? We are sitting on a gold mine. Very happy to be in India, but at the same time, unable to get the data. Data is marvelous. I mean, huge amount of data is available in India. Okay. Yeah. Anybody else? Any other questions, please? But anyhow, you are most welcome. You can collect my mail ID from mobile phone and mail ID from the organizers. And then you can contact me anytime for any clarifications. I'll be very happy to be part of you and help you in the process. It's a very important field. I want you to take up immediately. Electronics engineering, at least electronics level, IT, computer science, biomedical engineering, whatever good that you can do. Please understand, health informatics is 40% of health. Don't forget that. Almost $10 trillion worth field is health informatics. So much business is available. So much opportunities are available. But we are just a meager 1% in India, 99% to go. Just imagine the type of exponential expansion that health informatics is likely to get in India. I think we are all towards that. We have to work hard towards that. Yeah. Yeah. Have you understood the PowerPoint presentation? Was it fast or it was almost? I mean, you're able to understand. Praveen? Babu? Just an input. Okay, good. Thank you. Because I had so many in the slides, so I had to manage. I hope I managed well. So you should have understood the breadth and depth of health informatics. Nice. Thank you very much. Organizers, if there are no questions, thank you.